Good afternoon. My name is Chris Johnson. I'm an orthopedic surgeon who also has subspecialties in hand and microsurgery as well as sports medicine. I went to medical school at Robert Wood Johnson in New Brunswick. I subsequently did my orthopedic residency at Robert Wood Johnson. I then did a one-year fellowship in upper extremity reconstruction and microsurgery at the Indiana Hand Center. And I've been in private practice in the Jersey Shore area for 35 years. As an upper extremity surgeon, probably the most common procedures I'm doing are things like treatment of wrist fractures, release of Dupuytren's contracture, treatment of trigger fingers, carpal tunnel syndrome, cubital tunnel syndrome, which is a nerve irritation involving what people like to call the funny bone at the elbow, removal of masses of the hand, treatment of hand trauma, fractures of the wrist and the hand are very common in my practice. When I was a kid, I was born with an abnormal heart valve, so I got exposed to doctors early, and I think I liked watching them, and I thought that was pretty neat how they, came up with diagnoses and treatment. With respect to my field now, when I went into orthopedics, I didn't really have any preconceived notions about what I was going to do. During my residency, I had as a mentor a pretty well-known hand surgeon in the area, and he was a great role model for me and developed my interest in hand surgery. Well, I've known about Seaview Orthopaedics for a long time. I like the fact that Seaview is a multi-specialty orthopedic group, so you have people that have specific interest in subspecialties in orthopedics, because I think that's very important in how you deliver orthopedic care. The most rewarding part of my job is to meet someone, find out what their problem is, try to get the best possible diagnosis, and then help them through the process where they end up being happy in how they're feeling and what they're doing. I have several hobbies. I'm involved in sailing. I'm also involved in ice sailing, which we can do here in the Shrewsbury River. Big fan of the Liverpool football team. I have 4 children, and I like to spend time with them. I have experience over 35 years in treating people, so I think I'm pretty familiar with all types of people, trying to figure out what they specifically want, trying to make the best possible diagnosis, because from diagnosis flows treatment. I've always tried to exhaust conservative or non-operative care before I consider doing an operation. And I like to explain to my patients, both during treatment and at junction points, the why of what I'm recommending. I'm very optimistic about joining this new group. I'm looking forward to being able to see patients from this area, seeing that I was raised in Avon, so I consider myself a local kid.